Each year, flu strains or versions circulate in our community. And so they vary in kind of some big ways sometimes, and then they vary a lot of the time just very subtly. And so that has to do with the proteins on the influenza virus. And every year, those proteins kind of shift depending on the flavor or the version of the virus that is circulating. Just as an example, two versions, flu A and flu B, can sometimes circulate even within the same year. So all of this means that each year there's kind of a new virus or viruses to our immune system because they're subtly different. And so the vaccines attempt to account for that in these small differences. And we try to give your body a preview of what that virus might show up and do every year. One final little point is that with COVID-19 circulating, we know that we've got kind of extra need for caution this year. And our goal is to give your body as much of a head start as possible. And that's why we like to use the influenza vaccine to do so. Unfortunately, it doesn't. So influenza vaccine really only protects you against influenza. And so we're trying to figure out the COVID vaccine, but we don't have a COVID-19 vaccine at this time. If you are older than 6 months and your doctor or nurse practitioner or PA feels it's appropriate, the flu shot is for you. So it really depends very, very little. Most people can get it. There are a few people who shouldn't get it, but pretty much the line is if you're over 6 months, you should get flu vaccine.